Officer Reyes is halfway through the graveyard shift. 30 minutes since the incarcerated person on C block started seizing. 40 minutes since the call for a nurse that never came. 20 minutes since Reyes felt the tremor in his own hands. In a place built to punish, time itself feels weaponized. Every second without medical help could be lethal for the incarcerated or for the officer who must answer the alarm alone. And what happens when the people holding the keys are silently breaking down themselves? This is how it really works. Healthcare behind bars, the hidden crisis. Did you know that correctional officers have higher rates of PTSD than combat veterans? Since the Supreme Court's landmark decision in 1976, prisons have been required to provide every person in custody basic medical care. But the U.S. prison system was never built to be a hospital. Yet today, it's expected to be one. Nearly every incarcerated person in California, close to 90,000, has a documented medical need. Many require round-the-clock attention for seizures, mental health crises, or terminal illness. But the system doesn't have enough doctors or nurses to meet that demand. So, correctional officers like Reyes are often the first and only ones to respond. They do so with little to no medical training and often no support. The emotional and physical toll of these high-stress life-or-death situations falls squarely on them, leading to PTSD rates that approach and sometimes exceed those of military combat veterans. Many work under constant threat, with long hours, emotional isolation, and no support. They're more likely to take their own life than to die from an inmate assault. But most never ask for help, because corrections officers are trained to stay tough, stay silent, and never show weakness, even when they're breaking inside. California now spends over $4 billion a year on prison health care. Yet inside the walls, chronic delays, overwhelmed staff, and burned-out officers remain the norm. That's why U.S. correctional leaders, lawmakers, and advocates are visiting countries that take a different approach to health behind bars. In places like Norway and Germany, prison officers are trained more like mentors than guards. Their facilities are designed to feel less like warehouses and more like communities. Here at home, California is starting to adapt key parts of that model, beginning with pilot programs at San Quentin. They call it the California model. The goal is to help incarcerated people heal and support the officers who show up every day. And still, you have to wonder, will it be enough? Because this system was built to punish, and now we're asking it to heal, to protect, to care, pushing officers like Reyes and everyone inside closer to the breaking point. Most conversations about prison reform focus on bail, sentencing, and the treatment of prisoners. Rarely do we talk about those tasked with caring for them. So next time you're in a discussion about prison reform, remember the caretakers. Because now you know how it really works. This episode is part of our How It Really Works series at Independent Voter. Share, like, and follow for more.